Today, let's discuss what is the difference between breast milk and formula milk. We all recommend exclusive breastfeeding for the first 6 months and continued breastfeeding till 2 years. So what are the properties that make breast milk different from formula milk?
Don't forget to subscribe to the MFine channel and hit the bell icon to never miss any update.
To begin, in terms of the composition, breast milk has the most easily digestible and bioavailable type of protein called as whey protein, which is different from the casein which is there in formula milk, which makes it less easily digestible. Coming to the carbohydrate content, breast milk contains predominant lactose, while the combination of sucrose and lactose makes formula milk more prone or vulnerable for the child to develop subsequent obesity. Coming to the fat content, breast milk has the new buzzword in nutrition, which is DHA or docosahexaenoic acid, which is a very important part of the retina as well as the brain, and which is associated with much better development of intelligence or cognition in the child. Now, with all these properties, breastfed babies tend to have better IQ or intelligence quotient when compared to formula fed babies. Not only are they more intelligent, but breastfed babies are also less vulnerable to develop allergic conditions like skin allergy or atopic dermatitis and asthma and gastrointestinal conditions like Crohn's disease. The stooling pattern in breast milk fed babies is also much more easier in consistency than formula fed babies who are more prone for constipation. There are some studies to show that the risk of childhood cancers like acute blood leukemias and Hodgkin's lymphoma is also lesser with breast milk fed babies. Not only are these advantages true for children who are breastfed, but mothers who choose to exclusively breastfeed their children for the first 6 months are also at lesser risk of developing cancers, particularly breast cancer and ovarian cancer, and are more likely to return back to their pre-pregnancy weight when compared to mothers who choose to formula feed. So with all these advantages to the child, to the mother and to the community as a whole, what other reason are we expecting for not choosing breastfeeding? But do remember also that there are some unique situations where there may be a requirement for formula feeding. This may happen because of some maternal disease conditions which render the mother incapable of continuing exclusive breastfeeding, and these may include severe conditions like malignancies or cancers where mothers may have to take chemotherapeutic drugs which may be associated with potential side effects to the breastfeeding baby. Barring for these very few conditions and some pediatric conditions where babies may not be able to tolerate breast milk well, some inborn errors of metabolism which are mainly genetic, and some conditions such as galactosemia where the sugars present in the breast milk may become toxic to the baby, where we resort to special formula milk powders which have these proteins and sugars removed from them. Barring these very rare conditions, in almost every other situation, breast milk still remains the best foundation for a baby's long-term future. Thank you for watching this video.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.